This
And you're gonna be in
conference will
26th of
now
July.
be recorded.
I invade here. I thought 26th of July is good
I'll
time.
come back July 1st.
July 1st to come back in. What about you? 28th of July. Are you near to 28th of July? I love that. How do you? 28th. Suffer. I thought I would show.
Power bank.
Is it recorded now?
Yeah.
Did it say this conference will not be recorded? Just important. Because I will add this lecture to the drive. That's why. It's very important. So that's why I wanted to make sure it's recorded. Ready? Yes, done. Ready? Guys, can everybody sit down now and we're gonna start? The good thing we live in the academy, our food in the academy, drink in the academy, and then I'm thinking of having tents behind the back door so we can sleep there. If you are tired, yes, if you are tired, you can go in that tent. Huh?
You would love that.
Seriously, understand? If you are tired, you can, like, you can book it, write your name at Dr. Amr's name and book. Write your name and give you the keys. No, it's gonna be sunny now. Coming days is sunny. So I'm actually thinking of, behind the academy here, where between the academy and the mock place, I'm gonna actually bring seats and chairs and tables. So when it's sunny, people they wanna sit outside, they can sit outside. And someone to serve coffee and shisha. He's like, look at him. Imagine you are sitting in the bed. How can I help? I have headache.
Do it.
Huh?
You used to do it.
Since when? And then smoking cessation. Counseling. Yeah. And we're gonna write on this section COPD support groups. Okay. Let's start. Guys, we'll discuss today now ethics. Ethics and in the Egyptian accent, ethics. Ethics, yeah, that's an Egyptian accent, ethics. Okay, do you eat healthy? I eat healthy. You understand? So if you have a female who is coming with you and she won't the pill. She want what? The pill. The emergency pill. The long-term contraception. I don't really care. She's coming for the pill. Why does she want the pill? So she doesn't want to be pregnant. So we know we're gonna offer the pill, but the problem is, are we going to ask her to tell the family, or are we gonna tell the family ourselves? Do we give her the pill or not? If she's 14 years old, if she's what? 14 years old, do we give her the pill or not? But by giving her the pill, you are encouraging her to have sex. So do you give her the pill? You do give her the pill. You do. You do. So, not what? Did you say not advisable?
No, but we advise.
Okay. So I thought not advisable. I thought
No.
Yeah. So now, when to inform social services? When will we inform social services if she's having sex? Sorry? Partner age. If she's 14 and the partner is 14. No. If she's 15 and the partner is 15. What if she's 15 and the partner is 18?
Make sure it's not a position of power.
Our seniors. Okay, let's give you the rule. And so you know what to do. Okay? So we have age 13 and we have age 16. We have age what? 13 and age what? 16. 13 and 16. Guys, I can make 100 stations, 100 scenario. Out of this, you can make plenty. So between 13 and 16, what will you do? When I say 13 and 16, I want you to highlight 16. Highlight it. 16 is the age of consent. 16 is what? What do I mean by 16 is the age of consent? What do I mean by age of consent? So that means at this age, you can consent for sex, okay?
He has to take permission.
Fine. He's not actually zooming on me.
No, he's doing on all of us. And then it's on Facebook, and then our face is on the Facebook. But we don't want to be seen on the Facebook. It's all right, yeah?
So 13 and 16. 16 is the age of consent. So what do I mean by consent? Consent that she can give consent for sex. It's fine. So if she is 16 or more, any problem? Do you know what I mean by any problem? Do you want to tell anybody? No. No, you don't. You don't. You don't tell anyone. What do I mean by you don't tell anyone? So you inform social services? No. But if she's less than 16, look at that. Less than 16 and more than 13. This. So now we know more than 16 or more. Any problem? No problem. What about between 13 and 16? 13. More than 13, less than 16. Any problem? Guys, there is no problem unless there is two cases that you have to assess here. Number one, does she have any mental capacity or not? Mental capacity or not? Number two, the age of the partner. The age of the partner. So mental capacity and the age of partner. What do I mean by age of partner and mental capacity? Mental capacity means that if she knows what's going on, if she's not under any harm, if she understands, she can retain things. Her age of the partner, if they are within the same age, between 13 and 16, you do not inform social services. However, you only encourage her. You only what? Listen to this word. What? Encourage her to tell her parents. You do not force her.
No.
Encourage. It's highly advisable if you tell your parents. At the end of the day, they are your support system. What if she doesn't want? Nothing. So again, what is the age of consent? So if she's 17, 18, 19, any of this age, do you inform anyone? Do you inform social services? However, less than 16, more than 13, this period here, be careful. What? Be careful. There are two conditions. You must assess her mental. What is the meaning of assessing mental capacity? What is the meaning of mental capacity? What does that mean? Guys, mental capacity, because some people think that it's a big term. It's not a big term. Do you know what the pill is for? Yes, doctor. The pill will prevent you from being pregnant. Okay. Do you know what will happen if you don't be pregnant, doctor? Is that why I don't want to be pregnant? She has mental capacity. As simple as she can retain, she knows the risks and benefits. That's it. So she has. So if she's less than 16, more than 13, you must do two things. Assess her mental capacity and ask about the partner age. If the partner same age group, if she has mental capacity, anything you want to do? Nothing. But encourage her to tell her parents, and if she doesn't want to tell, nothing. You don't force her. Because some people, the patient or the female gives them the hint. I don't want my family to know. Well, at the end of the day, they are your support system, but I don't want them to know. Well, I highly advise you that you tell them, but I don't want them to know. Guys, I don't want them to know once. Done. It's fine. Do not keep pushing because it's not obligatory. It's not by force here. Okay. So, between 13 and 16, if any of these two conditions is not there, if there is no mental capacity, or if the partner is elder than her, elder than this age group,
I mean the years. How many of the age?
elder
No,
than
no, no,
16
no. The age of the partner.
in this group.
Yeah, yeah.
So if she is here, the partner should be
I mean the age of the partner. You say in the same.
if she's 14, he is 15. If,
Yeah.
he, if
No, 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 no. That part. I mean when it's we will inform.
That's what I was answering you. You will inform of the partner, not same group. What do you mean by same group? Elder than 16, because the age of consent is
The
16.
age of the partner. I mean, how many years of like
That's what I'm saying to you now. If he's older than 16,
yeah.
Older than
No, not that.
It's about to not older than.
If partner
let
is
her
older
talk.
than
Let her
16.
talk. I heard her say. So when do we inform?
I mean, the girl is 14 and the partner is 17.
You need to inform this. That's what I was answering you, but you're not giving out the.
Okay.
What I mean by same age group, you see this group between 15 and 16, they should be there both in this group. If one of them beyond 16, you inform. That's what he was all answering about. No. You no. That's what I was saying. I thought something else, so I said let's listen to her. So same age group means, you see, this is the age group.
All right.
Okay, if anybody outside the group, inform. So one of two things. So again, 14 and 15. Any problem? Don't say no. Say I need to assess capacity and age. If it's okay, age of the partner same 14, 15, it's fine. If she's had it, it's okay. When do we inform if one of them is not there? What do I mean? If they are the same age group but no mental capacity, or if there is mental capacity but he's not in the same age group, then you inform social services. Is it clear so far, this part? So if anyone in this group with anybody above 16, you inform right away. 14, 15. No. Assess capacity, and I want to also assess capacity. And that's why one of the very funny points that when you have a female who's any emergency contraception, whenever the female is coming, people are so scripted. What is the age of the partner? If I make it 18, you don't need to ask what age of the You get me, guys? Yeah. So in the emergency contraception station, everybody asks about blindly. They don't know that the age of the partner, you will need to ask about age of the partner only if she is here. But if she's 17, 18, Jonah, why do you want age of the partner if she's 18 years old? So please, if I change the age, don't ask. Because if you
Doctor, the
ask,
camera is off. We cannot
you
see
show me
anything.
that you don't know what I'm asking about. You get me, guys? Doctor, do you know what I'm talking about? Yeah? Okay. So now, if she is less than 13 or less, inform. So this is inform social services and inform everybody. Social services, parent, everybody. So inform. So 13 or less, inform. Between 13 and 16, it depends. Two things. Mental age, above 16, no problem.
And 16?
Yeah, 16 and above.
Okay, 16
age
and
of
above.
16 is the consent. 16 and above, yeah? What she's like. She's panicking, yeah? You can see she's like panicking, yeah. So, guys, any questions so far? Any questions so far? Any question? Okay, so a new station, because sometimes we get this mixed up. A male, a what? Male who is 14, 15, and a female who is 20. Because some people think that only a
Camera
female
is not
is
open.
abused. Seriously,
cannot see anything.
the reason I said this question because it's a new scenario. So, a male who is 15, and the female is. So some people think only if the female is young, it's abuse, and that's how we expect all the time. So if a male is 15 and a female is 20, what is that considered? Sorry? He's lucky.
What is he gonna do with the
So my point is inform. Again, social services. So he inform even if he's a male. Because we have this conception of female only. Male get abused as well, get harassed, everything, same. So be careful, okay? Be careful. If it's a male, of course, inform social as long as the female is elder, same as female and male, okay? But they told you the age of consent. What is the age of consent?
16 and 16 above.
But they told you the age of consent will raise. Will what? Go up, rise to 18 if the partner is in a position of trust. GP, teacher, head coach. So it will go up to 18. What do you mean? Age of consent is 16, yeah? But it will be 18 if the partner is in a position of trust. What do you mean? I mean, if the partner is her teacher, her GP, we put the consent 2 years above. So if she's over 16 or over, as long as the partner is not in trust, it's fine. So that means that the age of consent will go to 18 if the partner is what? So I will do 16, 18 in a position of trust. So if she is 17, if she is 17 and the partner is not in a position of trust, any problem? Inform anyone? But if she is 17 and the partner is in a position of trust, so my point is, if she is between 16 and 18, ask about the partner. How did you meet him? What does he do? Done. His job. How did you meet? Because that's what you want here. I hope you are not lost. So 17, you just need to know about how did you meet him? How did you know him? You understand? Because if he's in a position of trust, it's considered abuse. But if she's 17 and he's her friend from college, any problem? No. So that will tell you, yes, if she is up until 18, we do ask about how did you meet him. But not because it's abuse, but maybe he's in a position of. So any female under 18, you will ask. But why? I'll ask because, yes, the age of consent is 16, but in these 2 years, the age of consent will go up to 18 because if he's a position of trust. So now we will fix it. The up until 18, we will, how did you meet him? How did you know him? Till the age of 18. But deep down, you will know if they are friends. It's okay. But the problem, if he is in a position of trust. I hope it's clear. Because it's just like lines that are, there's no, doubts like the contraception 1 to 5, 5 to 2, 2 to 3. This is just above 13, below 16. 2 things to check. What are they? That's why the girl who is 14 asking for emergency, we tell her, do you know what is the pill for? Do you know why? Because she's under 16. So we are assessing and to ask her about the age of the partner. That's why. If any of them not there, inform. Above 16. I won't ask how did you meet, how did you know, because I know that it's okay unless there is a position of trust. 13 or under, everybody else. Okay? But when she's between 13 and 16, encourage her to tell her, but do not force her to tell her parents. Okay? You only encourage. So now if I make any station, please, I want you to know, Dr. Hisham, look like a GP consultant. Allah, chill, as chill. Wallahi al-Azim, chill كده as you know, seriously. If he's my GP, I'll be so confident. He's a good. How he's sitting, if he tells me anything, I will, So If I give you a 14 and 18, you know what to do. If I give you 14 and 14, you know what to do. If I give you 17, you know what to do. If I give you anything under 13, it is okay. There is something, take it or leave it, just extra little point called sexting. Called what?
Doctor,
What
please
is the
mute your
meaning of
mic.
sexting? Text to text. Sexting. Sexting. Coming from sex and text. Sexting. So basically, if you are sending sexual images, sexual videos, things like this, yes. Can you? He's my girlfriend. I'm sending her my body naked. She's my girlfriend. So the law here has not yet appeared, but I'm suspecting. So what? She's coming, complaining that my friend, my colleague, whatever, sending me pictures naked of himself. Huh? Block him. This is
I've seen him
so
already.
very good management. Very easy management. Block him.
I've seen him.
She managed the situation very well. Block him. Maybe share it on social media. And then it becomes a problem colleague. Yeah. So sexting, they said, if they are in a relationship, what I mean by that, in a relationship, what you mean with consent? The age of consent will go up to 18. So the age of consent is, so like what? Like position of trust. In the position of trust, what is the age of consent? 18. Same for sexting. Sexting, the consent is at 18. So unless she's 18 or over, it's okay. Under this, it's abuse. Under 18 is abuse, considered abuse. So that's for sexting. So what is the age of consent in general? 16. It goes up to 18 if the partner is not. So up until 18, you will ask about the partner. How did you meet him? How did you know him? Sexting. If they are in a relationship, consensual, they are giving consent, it's fine. But I'm saying, as long as the age of consent is 18, that's the age of, exactly. If she's under 16, that's the age of consent. It's under, she's 15, he's 15. In a relationship, mental capacity age is okay. Any problem? Same. But here, it's not 16 anymore. It is 18 if it's 16. Clear, guys? Doctor? Any doubt? Okay. I know if there is doubts, not from the facial expression. If someone is like, I know everything is okay. If someone is, that's very okay. Very okay. Seriously. If the one is, that's not okay. Yeah. So I know that whenever she's like, I know she's having a concern. She doesn't need to say it to me, but you know.
So 17,
But from God, CBT, sitting next to her. CBT, calm down. I will tell you later. Don't worry. Seriously, always she's telling her, relax, everything will be okay. I'll tell you later. Yes. So, of course. You will not inform social services, but you will ask about the relationship. Maybe he is her counselor. You remember change of counselor? Maybe he's her counselor. Maybe you took her details from the system. So how did you meet him? You get me, guys? Well, we met one day in a party. But look at this. Well, you know, I came one day and, you know, he loved me so much that he took my details of the system. Then he contacted me. Yes, you'll instant form. And you get me, guys? You get me? Do you understand? Yes, you can still inform if you think he got, yeah, the details of the system. Sorry? But still, guys, above 18, but it could be an abuse there. Maybe above 18, he's her counselor. He's her counselor. Yes, he's my counselor. I have depression, and I'm his patient, and then we started dating. Does that smell good? Then you're not gonna do anything about instant form, something, you know. But they don't get beyond. They don't go to that, you know, like that level. The level maximum, she's 14, he's 18, straightforward. She's 14, he's 19. She's 14, he's 14. No? Why? Because people even don't know this thing. People just, they script a certain situation and they go for it. They don't actually know if it's below, if it's above. You know, you do that here, you do that there. People trust me. This lecture is beyond, you know, people have one scenario, 14 years old, ask them for emergency contraception. That's it. But now we're making it a bit. Okay, anyway. So, guys, there is now, this is the part I wanted to tell you about in terms of age and consent. I hope it is clear. Now, recently, there are stations where I want to simulate it better. I want to simulate it. I don't want to talk about it because now it's the part is done for contraception. This part is done. Now I want to simulate 2-3 stations, and I want to give the mistakes and give the feedback, and you spotting what's going on wrong better than me just talking now. Okay? So I'll pick one doctor and we'll do a station. Very easy, simple station. Okay? Yes. You. Yes. If anybody doesn't want to come, don't come. This is optional now. If you say, well, I'm not comfortable, really, don't, you know? So that's not by force. But I highly suggest that you come. You know, we'll give you feedback and you will see how you handle pressure. But if you're not happy to come, you don't want to come. It's okay. If you don't want to come, don't come. It's fine. It's fine. Dr. Iman, gonna come? If you don't want, don't. Okay. Dr. Yes, come. Gonna come? Yeah. You okay or? Okay. Yes, perfect. Perfect. Guys, very, very important. Okay, let's start. Let's start. I will give you messages, guys. I will give you messages. Guys, in the back here. Do you want to come in the front? Dr. Sama, Dr. You know? Because he might not be able to raise his voice to a certain limit, but there are chairs here. So please, if he cannot raise his voice, fair enough, he's stressed. He cannot, you know? I can raise my voice, but he can't. So we've got seats here. If anybody think that he might not hear, come closer because he might not. I cannot force him to speak louder if he can't speak louder. So, okay? Oh, what's your name? Farhat. Where are you from? Bangladesh. What about in Bangladesh? Dhaka or? Dhaka. Always ask, how much do you know about Bangladesh? I know Dhaka and I know. Yes. It's another big city. Yes, she knew that. She doesn't. I love that. I love it. She said he doesn't know. She could see from. Huh? That's good. Doctor is a good observer. He doesn't know. He just like he doesn't know. No, I don't know actually.
Because you paused and you're thinking. Sorry? You paused for a moment and you're thinking that shall I say yes or no?
You see, but this is good. That's the meaning of observe. The patient doesn't need to tell you something, but she could spot from my expressions. He knows nothing. Okay, let's start, Dr. Farhat. Guys, please, I'm gonna simulate 3 stations, 4 stations, and you have the olive in these stations, okay? And they are all new ideas, new tricks that makes you get 0, 0, 0. No, sir. The tricks, if you don't get it, you fail. Not tricks like failure, life-threatening tricks. Okay? That's why I said, please, you should all be hearing us and don't be just chilling and not hearing and ignoring us, yeah? So, I am 55 years old. Mahira Khan. He's happy now. His face, nice to meet you, Mahira. You know? presented to the GP clinic with a concern. What about a man? What? GP. Yes. Okay. Yes. Start. You have a phone, your own phone. Can you give it to doctor? What's your name?
Charmaine.
Charmaine. Dr. Charmaine. Where are you from, Dr. Charmaine?
Bangladesh.
Bangladesh. What about Bangladesh? How much is wrong with Bangladesh? You see that? You see this? How much is wrong with Bangladesh? I know the Haka. I'm going to the Haka in July.
Have you ever been to Dhaka?
I'm going in July.
Oh wow.
Yeah, I'm going in July. But I've never been, but in July, inshallah. So, like, mid-July. Sorry?
For the timer?
No. Get your video. She will video you and you watch yourself later. Okay? Because that's the best way, guys. Video yourself. You should have at least one video of yourself. Please, at least one video. Then you will be able to judge yourself. So, 55 years old, Mahira Khan with a beard. Presented to the GP clinic with a concern.
Hello, my name is Dr. Farhad. I'm one of the junior doctors working in this GP
Hello, doctor.
I can see that you are having some trouble.
I'm having some chest pain, doctor.
Okay, before I go into that, can you please confirm your name and age for me?
My name is Mahira Khan, doctor. I'm 55 years old, doctor.
Okay, Mahira, you are telling me that you are having some chest
Yes,
pain.
doctor. I feel somebody is pressing on my chest.
Okay, since long
Here,
you are having
doctor.
this?
For about 3 hours now, doctor.
3 hours now.
It's here.
And it's something, someone sitting up there, okay?
Somebody's properly
Pain.
chilling up there, doctor.
Okay.
Yes.
Does the pain go anywhere else?
Just this area, doctor. Like this. Just,
Okay.
Yes. Goes here a bit.
Does it go to your
No,
jaw?
not too much. No,
Left arm?
no, just here, doctor.
Okay.
Yes.
Anything that makes you feel better?
Feel short of breath, doctor. Just
Okay,
like
feel
it's very bad to the level that I'm feeling short of breath, doctor.
Anything that make it worse?
No, doctor. Just when I breathe, I feel more pain, doctor.
Okay. Can you please score your pain and scale of 0 to 10? 0 is
12, doctor.
it's maximum pain. Okay.
Yes.
And you are also telling me about the shortness of breath. Has it started with your chest pain?
They came together, doctor.
They came together.
Yes.
Have you anything apart from this pain and shortness of breath you want to mention?
No, doctor. No. No.
Any sweating?
No, doctor. No.
Did you feel any vomit or any
No,
sickness?
doctor. I feel a bit sick, but I did not vomit. No.
Did not vomit. Okay. Do you have any? Do you have this pain above before?
No, doctor. No. No.
Okay. Do you? You said that breathing is increased your pain.
Yes.
Have you any injury to chest?
No, doctor. No trauma.
Any cough?
No.
Any fever?
No.
Nothing like that.
No.
Okay. Do you have any medical condition?
Fit and well, doctor. Apart from high blood pressure and diabetes, doctor.
How you are controlling them?
Following up with my doctor. Following up in the clinic here, doctor, and
Is
I'm
it
taking
normal?
medication. I don't know, doctor, but I'm taking my medication, doctor.
Can you please mention me the medication?
I'm taking Ramipril, doctor, for the blood pressure, and I'm on insulin for diabetes, doctor.
Okay. Can you please tell me that do you smoke?
I do, doctor, smoke.
How much?
I smoke, how much what?
How much do you smoke?
How much what, doctor?
What do you smoke?
I smoke shisha, doctor.
Shisha.
Yes.
Any alcohol?
Sorry?
Any alcohol?
Do you drink alcohol? I do drink alcohol, doctor.
How much?
I drink vodka and I drink gin once a day, doctor.
Okay. Any medications apart from the Remipil and?
No, doctor.
Have you tried anything for your pain, chest pain?
I try to take the doctor because I'm just.
I can see that you are having much struggle.
Yes,
but just bear me with some questions. Do you have any allergies?
No, doctor, no allergy, doctor.
Who in the family has infected illness you want to mention?
In the family, my father, he died of heart attack.
Okay.
And my mother, in her family, they having breast cancer in the family.
Okay. So, if you have, do you have an idea what might be happening?
No
idea.
No idea at all.
So, do you have any expectation from me? What might?
No, anything.
Okay. So, what I'm going to do now, I'm going to check your vitals. I'll check your blood pressure. I'll check your temperature, pulse, oxygen saturation, and also do general physical examination, including your heart, listen to your heart, and also lungs. Is that fine?
Yeah.
Is there any findings?
No.
Okay. So, what I'm going to do, I'm as you what I'm going to do as you having this chest pain for
Yeah.
last
Yeah.
3 hours,
Yeah.
3 hours, and I'm really concerned about your chest pain. Okay, so
Any
I'm going
painkiller like paracetamol or something?
I'm going to say that how
Okay.
I'm going to help you.
All right.
So what I'm going to do now, I'm really concerned about it. This pain. It could be something serious.
All right. Okay.
So that's why I want to send you to hospital.
Too late. So deep down, I will fill him the station without even feeling guilty. I'm giving you feedback now, so don't take it.
No, absolutely.
We need to just know how can we. In this case, he will fail. No doubt, he will pass ever. He will fail the station. Done. Why? This case, after the first 2 minutes, you will say to him or to her, I will ring the ambulance because you need to go to the hospital right now. Then you can carry on doing whatever you want to do. This is I'm suspecting something serious here, or I would like to exclude something serious here, which is heart attack. So I'm sorry, before we carry on, I will contact the ambulance because you need to be moved now to the emergency now, immediately, not, and we will check your observation right away and you'll go to the hospital. You will be moved to I'll contact the ambulance and you'll go to right now. And then carry on taking your history and managing whatever you want to manage. But at the moment, after 2 minutes, I said to him, family history. Do you think if I'm having a heart attack,
Yeah.
I will? Do you smoke? Well, I do smoke. What do you smoke? Well,
Significant in this scenario.
no. I need ambulance. Contact ambulance now. Immediately, you need to go to the A&E right now. And I will be checking your observation now. And then carry on, taking your history, but not smoking, not how is your diet, not what do you smoke and how do you smoke. No. Guys, please, I hope you got my point. Okay? So, now, doctor, he told me ambulance now, yeah? He told me as if he told me, yeah? So, doctor, please, doctor, I'm not going to wait for the ambulance. Come, my husband is outside. Can he take me to the hospital now? Please.
Yes.
Okay,
Yes,
doctor.
you can.
Fail again. Fail again. But I said to him,
I was believing you.
I said to him, can you take my husband? He looked at me. No, she has to go by ambulance. He said, you take me. By the way, these concerns happened. It's not made now by me. I'm telling you, okay?
No.
So, well, yes.
Isn't the husband better option? Ambulance
No.
might take some time.
No, brother. Her husband is not better option because this is an emergency ambulance. They come according to emergencies. So when they ring, we need the ambulance. Why? Well, because I had a fall, I was drunk. I've got some pain in my ankle, I've got some pain in my little finger, Then the ambulance, 12 hours. Well, ambulance, why? Severe chest pain, central crushing, suspected MI. 5 minutes, 3 minutes outside. Boom. You get me? So there is triage for ambulance as well. It's not like haphazard. Your husband can take. What if she collapsed and your husband the car? You get me? The reason why ambulance, it's more safe. Clear. So how would you approach the station? No smoking. That's why when I failed him, I started. Okay, yeah, it's fine.
No problem. Just carry on.
All right, that's it. Which means, regardless of what you say,
You have done.
it is an emergency station. Can it come this in GP? Yes, it can. Yes, it came as well. Yes, it's a station. Yes, you will fail if you take history and smoking and no. After 1.5 minutes, after exploring the pain, site, point to one finger, here doctor. Where does it go? Here doctor. This area doctor. The jaw, no jaw doctor. It's fine then. No jaw, no problem. No, I said to you, I don't need to give you like the arm and the jaw. No, I said to him, here doctor, here, and then anything else, shortness of breath. Come on. That's now fair enough. Okay, because otherwise, if you stay with him taking history, he will go on the slide. You know what the slide? What? He will die, like, because yes. Okay, so then you can say stop, ambulance, emergency, immediately. These words must come, and then I will check your observation now. You understand? I will put a line. Yes, we'll give you some painkiller, and then you can carry on with the history. It's fine. Clear. Yes, and you can give him painkiller now. You can give him GTN spray. Yes. Clear, guys? Next station. This is, about MI, but you don't know that in this station you will stop the station and you will do this.
Is it the same? All the emergency cases, I have to mention this ambulance.
What do you think?
I think yes.
Brother, now he's saying to me, what about the loading goods aspirin? Brother, just ambulance. You will give him GTN, you'll give him painkiller, you can give him morphine, but that's after you already say ambulance, emergency, now, immediately, now, hospital, and you need to make it obvious that it's next station. Guys, that's the whole purpose of this station. Okay? Guys, what about phone consultation? Why do people fail phone? Easy. They came out, I did everything. I give him everything. No, you fail because on a phone consultation, hi, doctor, severe pain in my eye, and you're suspecting glaucoma, yeah? Okay, well, I highly advise you that you can come now to the hospital, to the GP clinic. We're gonna review you. Now, ambulance, immediate, urgent, hospital words to show them. No. This is not a case of chilling for 8 minutes. You understand? On the phone, taking family history. No. Well, Andrew, from what you've told me, I'm suspecting something urgent, something serious here. So before we go ahead with the consultation, it's all right if I will call the ambulance because they need to come to you right now and take you to the and in the hospital because you need urgent. Yes, urgent management. This is how to pass. Not like, okay, what is the chest pain? Doctor, severe central crash. Oh, does it go to the jaw? Yes. Oh my God, that's so terrible. Okay, anybody in the family who has a medical condition, or apart from that, how is it affecting your life and daily activity? Are you in any allergy at all? No, it's not. It's boom together, and after that you can carry on with the taking history, whatever, because the ambulance will be on the way. Next station. Okay, glaucoma, acute glaucoma, same. MI, same. A mother who's ringing you, guys, a mother who's ringing you, son, grunting, can't breathe, doctor, short of breath, he's turning blue, doctor, he's lethargic, he's drowsy. Well, how is his development? What about the red book? Is it red or yellow now, or is it what color is it? Guys, once she gives you red flags, the station will change right away to now. I will have to call the ambulance. Keep an eye on him. Is he in front of you? Yes. Keep an eye on him. I'll have to ring the ambulance because they need to come right now and take Adam to the hospital because he will need urgent treatment. Because from what you've told me, I'm suspecting that he might be severely dehydrated. Oh my God, doctor, my consultation is, not structured. Now we are giving her, the diagnosis before, we got emergency. Did you get the point? Dehydration, child short of breath, someone MI. And now I've given you two positions, phone, videos, face-to-face. In all of them, if you not spotting emergency, if you're not spotting, oh my God, something is going on here, you fill the station. Okay, next. Thank you very much. Thank you. Sorry,
No problem.
but you got it. You got it, yeah. You remember me in the exam now, because in the exam, they bring plenty of this plenty. Then once you spot that there is something going on and you don't act quickly, because time is money. Time is money. Time is critical, guys. Please, time is critical here. Next. You wanna come? Yeah. Okay. You don't wanna? Why you wanna come? Why didn't you come? And then you ask. What do you wanna ask? No, brother. There and then. Check observation. If you say if the patient is in the A&E and I'm suspecting MI, check observation, oxygen, blood pressure, check the observation, everything, cannula, morphine, oxygen, nitroglycerin, aspirin. You get me? Then you can do whatever you want. It is an emergency. We would not take. You know how severe is the chest pain of the heart attack? I've never had, alhamdulillah, heart attack, but I've seen it's the patient is so severe chest pain, shortness of breath. You cannot. So anybody in the family with the heart attack or they smoke. You understand? It's no. So you start managing early. Yes. ECG.
Dr. Mo?
ECG. Sorry.
Dr. Mo?
Yes. Please ECG. Cardiac enzymes, heart attack markers. I will give you boom. Mona. Guys, we should not stay longer than what I said because it's really.
Dr. Mo?
Stop at any moment. You hear it is urgent. Stop. If you are in the GP, if you are over the phone, over the video, call. Say I will call the ambulance. Show urgency immediately because I'm suspecting something urgent. We need to go to the hospital now, and then we can carry on with our consultation. And then you can. Yes, guys. Yes, we give GTN. Yes, GTN spray. Yes.
Dr. Mo?
And then. Yes.
Dr. Mo, can we, in the GP clinic, if it's an emergency, can we give the Mona?
Yes, in the GP clinic, I'll give the GTN. They put the camera in the ambulance. Cannula where? In the ambulance, they put cannula guy. The ambulance guy, the paramedics, But my point is, it's not about what to do here, what to do there. It's about, showing, talking about, mentioning, highlighting emergency. Next station. Who wants to come? Next station. Who wants to come? You wanna come? Hello? Yeah. How are you? Can we discuss later? Yeah. Oh, I'll give you something urgent or something. Okay. Doctor, did you get something here? Yeah. Okay. Now I will give you another trick for some other situation. Yeah. So now another trick. Guys, did you learn anything from this? Guys, there is no family and medical and data and no, there is no. Okay. And how do you know? You will know. A mother is crying, her son is not breathing. Her son is lethargic, drowsy, sleepy. Doctor, I don't know, he's not. Okay. Sit down. I love your smile. When you open the door every morning and I'm the academy and you like smiling, it makes me feel welcome in the academy.
Smile is gone now, see?
Why is gone now? Stress?
Public speaking.
Public speaking. No, you need to get used to this. Okay, so now Mahira Khan, 25 years old. Happy, huh? I can see like 25 years old. Presented to you in the GP clinic with lower tummy pain. Lower tummy pain. Yes.
Hi, I'm Dr.
Guys,
Masih.
can you all listen, please? Because this station is very important. Very important, yeah? Very important. ABC PLAB 2. This ethics, ABC PLAB 2. Contraception, ABC PLAB 2. This one, APC live. You must. Yes, start.
Hi, I'm Dr. Mustafa. I'm one of the doctors here in this
Hello,
department.
Dr. Mustafa. Hello.
Can you confirm your full name and age for me, please?
Well, my name is Mahira Khan, and I'm 25 years old.
Hello, Mahira. How can I help you?
Well, I'm having some lower tummy discomfort, doctor, and discharge from my front passage, doctor.
Please take your time to talk about it. But first, are you comfortable enough to talk?
Yeah, yeah.
All right. So can you tell me more about this pain?
Well, just in my lower tummy, it's like more of discomfort than pain, and discharge from my front passage, and yeah, some pain when I pass urine, stinging when I pass urine.
So tell me about this discharge. How frequent does it happen?
Well, it's just like for the past 3 days. I mean, I put the underpants now, and whenever I change it, I see that there's some discharge in my underpants.
You noticed anything about the discharge? Different color,
It's not. It doesn't smell good, doctor. It doesn't smell good.
All right. And how long have you had this pain, the one you mentioned earlier?
Around the same time, like 3 days now.
And do you have any other symptoms? to complain of?
No, doctor. No.
Do you have any fever?
No.
Any loin pain?
No.
No nausea or vomiting?
No, doctor. No.
Does this pain go anywhere else?
No.
All right. Here, are you possibly diagnosed with any medical condition?
Not really. I'm fit and well, doctor.
Do you have any allergies?
No.
Okay, so for this, I need to draw some blood, do the routine lab work. I need to take your vitals, do a general physical examination. I also need to examine your tongue. Would that be okay?
All right, doctor. Okay. Guys, please listen carefully.
Okay, so here, based on my assessment, I still can't reach the reason behind the symptoms you're experiencing. So I might need to ask you further questions regarding your medical history. Would that be all right?
Okay.
So
Anybody having timer?
So based on your life, can you tell me more about your lifestyle? How's your diet?
Well, I eat healthy, doctor.
What about exercise?
I do exercise, doctor.
Do you smoke?
No, I don't like smoking, doctor.
Questions, they might be a bit sensitive, but they're part of the consultation. They're necessary. Are you sexually active?
Very active, doctor, yes.
Are you in a stable relationship?
Yes.
Do you practice safe sex?
No, I don't like condoms, doctor.
And have you noticed that your partners had any urinary tract symptoms? Did they complain of anything?
No, doctor, no.
Well, based on the history you've given me, I think this might be a case of a bug. You caught it in your genital system. For this, we might need to do a urine dip. Would that be okay?
A bug? Why would I have this bug, doctor? What do you mean bug in my urine? So you mean water infection or?
Well, based on the results we'll get from the urine dip, we can't say more for sure.
All right, urine dipstick. All right.
Do you have any concerns you want to tell me before we move on?
No, doctor, I'm just worried. I mean, why am I having this and what is going on, doctor? What can it be, doctor?
Well, the bug can be caused for multiple reasons. Maybe
please listen carefully, guys.
It could be part of a weakened immune system.
Right.
You might have caught it from your partner or from a previous partner. If it's there. Sometimes these bugs can stay.
What do you mean caught it from my partner? Do you mean that my partner? Do you want to say that she gave it to me?
No, I'm not making any accusations because these infections can lay without symptoms for long periods of time.
I know, but do you want to say that she gave it to me? I mean, just please clarify it here. Do you want to say that she gave me this bug?
Well, we cannot say that for sure.
Do you want to say that? You want to say that Ashwarya is cheating on me?
Again, I cannot give you a clear answer on this until we get you both tested.
Okay, but the thing is here, how can I get it? Because I don't really understand. How can I get it if I'm lesbian? I mean, how? I mean, I don't really understand.
Well, you gave me from your history that you do not practice safe sex.
Yes, I mean, we don't like these things. Yes, male, female condom. We don't like any barriers, basically. But how can she? I mean, I'm very stressed out about it. I just want to know what could it be now? You said bug on my. What do you mean bug on my genital urinary system? Do you mean urine infection? Do you mean STI? What are you suspecting, really?
Well, to answer this question, I need ask you one last thing.
You can ask. Yes, feel
By
free,
any
doctor.
chance, you and your partner share sexual toys?
Yes, we do. Of course, that's the only way we, stimulate each other through sexual toys. Yes, we do use sexual toys. Yes.
I believe this is the answer to your concern.
All right. Okay. So you believe that I could be sharing sexual toys? All right. Okay. Okay.
So for that, we would like to get you tested
All right.
for other STIs if there are.
Okay.
But first, we need to confirm that through the urine dip.
All right.
And if it's possible, we would like you to bring your partner over so we can
No,
test her.
no, no. I'm not gonna bring my partner. No, no.
That's all
No,
right.
I'm not
We
gonna
cannot-
tell my partner to come
We
and.
cannot force you to do anything you don't want. But may I ask you why you don't want to inform your partner?
Well, because we're gonna have issues now, in the form of who gave it to who, and and then she will be really upset from me and offended. Maybe I give it to her. I don't have troubles with her.
Well, I can see that this could be a source of distress to you and that you care so much about this relationship. But telling her and getting her to get tested can make it easier to get you both treated as you can.
No, no, I don't. I mean, it's fine. I will be treated, and that's it. I mean, fair enough. I'm treated, and that's it.
You can catch it again from her if she doesn't get treated as well.
Right.
Again, if you both don't get treated, you might develop complications,
Oh.
which aren't very favorable. They might be serious.
Okay. Okay. So all right. Okay. It's fine. I'll tell her.
And until then, I would highly advise you to practice safer sex.
Okay. All right. Okay. What do you mean safer sex? You mean don't share toys?
Please.
All right. Okay. Okay.
And for that, I might need to inform my seniors as well about your condition. They might need to, for further tests,
all right.
You might need to get a jelly scan of your abdomen to prove that there are any further complications.
Okay.
They might prescribe you medication.
Anything? Medication, antibiotic, anything? Investigations? Okay.
As you told me that you're complaining of discomfort, we might prescribe you some painkillers.
All right.
And for the infection, we might be giving you some antibiotics. Would
All
that be all right?
Okay. You're gonna take a swab from discharge, doctor.
I believe so. My seniors will get.
Your senior as well? Will you send them to do the swab?
I'll take the swab. They will do the results.
All right. Okay. Anything else, doctor?
I give you some reading materials about your condition so you can be more informed about how to have safe sex.
You mean leaflet, doctor?
Yeah.
All right. I love people love leaflet. I don't know why.
Oh,
I know, but more important things to say management than leaflet. Manage leaflet than leaflet. The antibiotics and the safe sex and STI screening. You must ask for screening, and you must tell her. And you must ask her, have you been ever tested for full STI screening and HIV? Very important, guys. Have you been tested? And when was the last time you've been tested? And what was the result? And we will test you again. Have you been
tested?
When was the last time you were tested? And what was the result? And we will.
How was it managed?
And we will test you as well. So, guys, STI screening. Well, she's 25, so it should be the first time she will have it. I mean, that's 25 years old, so it's not. I mean, they start at 25, but it's not like a fundamental thing in our station. You understand? But if you ask, I mean, were you tested or not? If not, but it's not really. But did you see how I played with him? Why? Unless you understand this topic, you will be lost. What do you mean you will be lost? I'm lesbian, and I shocked them at the she. You get me, guys? So, the problem with STI topic, it is a topic for you to understand. A topic for you not to memorize it from books, understand it. A female coming with discharge. Top differential from the vagina. Top differential, STI. Second, UTI. So top differential is STI. Second, UTI. So a female coming with discharge. Top questions, sexual history and before. Am I pregnant or not? Maybe, yes, I'm lesbian, but maybe I tried something. My point is my period important for you? So my point is, in such cases, presenting complaint is discharge, explore. Right after you explore, associated symptoms: pain while passing urine, abdominal pain, explore. Main concern, and then 3-4 differential. What is the top one? STI. What is the second one? And then STI. What is the first letter on STI? S6. Brother, STI 6 على طول. Sexual history. He asked sexual history after he examined, he remembered, he went back again. Sexual history. Are you sexually active? And when I say sexual history, quickly or in details? No, this case is in details. For how long have you been sexually active? Stable partner or not? Any other partners? And you need to ask about how's the partner, because it's a partner. And when, where, or have you been tested for STI and HIV? And yes, doctor, I've been. When? If she said yes, I have been, you need to ask when. What was the result? And have you ever changed your partner since then? Think about it. You need to know what you're asking about. If I've been tested 6 months ago and it was negative, the question that will come after, have you changed? Because if I haven't, to change your partner. So, but if I did, clear. Do you know what I'm talking about now? Yes. Okay. So, sexual history, and after that, sexual toys. Sexual toys. Do you share to? So now I said to him lesbian. By the way, nowadays, Wallah al-Azim, we play with the station as I played with him. Speak to your colleague, you will know. We play now as we play. I don't want to know anything, but does he really understand what is STI? Does he really understand how? Does he understand? Not does he know a specific station? How many times you see written STI today case, and then at the result 000 111? Because of these things, this finding I gave him, that it was for him first time finding. Yes, I'm lesbian, but how did I get a doctor? Playing with it, but he understands. I knew he understands. I knew. Why? Because every time I give him a word, when did he ask about sexual toys? When he knew that I am. Many doctors I could have given them, I'm lesbian, and they said, lesbian, but you have discharge. No, but no. Right away, lesbian, bomb, sexual toys. So I knew that he understand, but he needed somebody to remind him. Not many doctors, I will tell them, listen, and they will ask me. Seriously, wallahi, not many. I'm telling you the truth. Not many doctors. Once I say the word lesbian, they will follow up with sexual toy. But he quick. What is the only way now? This sexual toys. So you start asking sexual toys. But I wanted him to think in advance that whenever a female is coming with discharge, you will ask about the discharge in detail. What is the color of it? What is the smell of it? Any blood in it? I'm asking you. Any blood in it? I don't know. Smell? Okay, color? No, color. What color? I mean, guys, I need it. I need track clear. When I distract you, but what color is it? Any blood in it? You understand? Like this. Have you ever had this discharge before? So my point is.
Sorry to interrupt. I have mock. Can I go?
Yeah, of course. Good luck with the mock.
Thank you.
Remember what I said, yeah, because they keep blaming me. Dr. Mo, we tell them MI and they say they take history. I said I would kill them. So remember, any female with discharge, explore discharge right away, associated symptoms, concern, first differential, sexual history, second is UTI, and you have not, and then the partner. Sexual history in details, guys. You ask it late. And then in management, what is the management? Guys, look, urine depth, look, number one, blood. Number one, including
and other
STI screening, fall, and HIV. Number two, and swab. So urine dipstick, swab. Please, guys, don't forget, 3 simple. Blood, including STI screening, HIV, swab, urine dipstick. Start on antibiotic, and talk about the partner, and talk about condom. Condom, because it's the only way to protect against STI. And talk about the partner. You need to bring him. Yes, doctor.
Antibiotic depends on the diagnosis, right? Do we give a particular diagnosis which infection
About
is?
the
But
result.
in this case, it will be a case of follow. So what do you mean follow? Start with discharge. During history, unprotected sex. During history, never been tested. During history, you know that she's, then it will be broke down till yes, give her antibiotic. You get me? So in the exam,
So, like, do we reach a particular diagnosis? It's gonorrhea, it's syphilis, it's
are you not depending on the swab? Depending on the swab, but
right,
it's
so the
STI.
examiner will give you the results,
Yes,
right?
yes. But even if you don't give any result, you say I'm suspecting sexually transmitted infection, because in the station it will be going as unprotected sex, multiple partners, discharge, So yeah, clear. But in these stations, you must talk about the partner. You must talk about safe sex. Condom in management is a must. If you have an STI case without telling it about condoms and safe sex, you've had it. Because the reason is unprotected sex. You must do advisor with and condoms, protected sex. Okay. Next station. Thank you very much.
Dr. Mo,
I hope you got the. It's an STI case, guys.
I mainly practice with male patients. That's the
Male.
problem.
P4 lost. Really? Yeah. Have you noticed something? Have you noticed something? In my course, in my online course, I always tell you to be superficial, and I always give you keys for every station I give you. And you will notice when we practice, people forget the keys. So that's the importance of knowing for every station. No, guys, every station has 2-3 words. And in my course, I mentioned in every single station, guys, this is female 25, P4. That's P4. P4, so pregnancy, period, pills, pap smear, sexual history. Guys, this is station, acne, pregnancy, liver problem. So every station, there are keywords. But if you in every station don't have the keywords and just go on haphazard, you will forget the main things. You see, he forgot one of the main stuff. Okay, last station. Last station.
Dr. Mo,
Yes.
is it okay if we ask the patient about their sexual orientation at the
You can
beginning of
ask
the
the
sexual
patient.
history?
You can ask the patient anything you want. The patient is yours. If you think a question is relevant, ask. If you think that you are going toward HIV, is orientation important for you and everything like this? Yes. And do you want to know about the root? Is it anal? Is it vaginal? Is it
Yes.
important in HIV?
Yes.
Yeah. HIV.
hello.
The root is important.
Yes. Yes.
So of course, so if you think it is important, ask. That's why I said relevant history. Like I was not expecting from him diet. I did not want exercise from him. Why? What will I do the discharge? Do the discharge. Exercise. Irrelevant. Yes, hygiene, okay, I accept it. But diet, okay. That's why I said I will repeat again and again. Write down how to have relevant history. Relevant history. That's a very important topic. Relevant history. Relevant history. Write down. Presenting complaint. That's a modified history taking structure. Presenting complaint. And after that, Dr. Sama, associated symptoms. What is the meaning of associated symptoms? What is the meaning of associated symptoms? Not differential. Associated symptoms mean a part of the chart. What symptom do I have? So associated, common with that. Then concern. The third word is concern. Then for differential, and I think for relevant differential. Relevant. What do I mean by for relevant? Like in this case, what is the top differential? STI. Second, UTI. So top relevant. 4. Then flows. Then medical condition, medication, allergy. Write the 3 words: medical condition, medication, allergy. Plus or minus DESA and Maftosa. I said what? What do I mean by plus or minus DESA and Maftosa? What do you want from DESA? I need sexual history. Get it out, done. What do you want from Maftosa? I need family history. Out, done, done. But as long as, look, I'll give you an example. Look, How can I help you? Doctor, I have discharge. Explore. That's presenting complaint. Any other symptoms? Abdominal pain, doctor, and penile passing urine. Explore. Associated symptoms. What's your main worry today? Doctor, I'm worried about STI. Main concern. Then, top differential. How many differential? First is STI. Second is UTI. And when you ask about STI, you will ask about sexual history, the cause for STI. So whenever you have a differential, ask about the cause for it. And then you will end up by flows, and then any medical condition, allergy, no, doctor. By this, you finish the test. You finish. Diet, presenting complaint, associated symptoms, concern for differential, red flags, medical condition, medication, allergy, you are done. Plus or minus this and maftosa. So this and maftosa, what you want from it, not all of it. Last station, guys. Last station. Last station. Final station. Last station.
Dr. Mo, can I do one station?
Well, it's better to be, you know, so face to face, and or you can do, why not? What's your name?
Dr. Batul Fatma.
Sorry?
Batul Fatma.
Batul Fatma. Okay. Can you close that door?
Hello?
That door?
Dr. Mo?
Yes.
Doctor, the last station, could it be BID as well?
Could it be what? Of course.
BID? Yeah.
Of course. It could be PID. That's why you need to ask about procedure, IUD, and you need to ask about, have you ever had any STI before? Because a previous STI can lead to, of course. Dr. Fatima Batul, guys, can we please, because I want all of you to hear, and I think it's you can hear her if we all quiet. Dr. Fatima Batul.
Yes.
Where are you from?
I'm from Pakistan.
Pakistan. What about in Pakistan, doctor?
Sorry?
What about in Pakistan?
From Karachi. Actually, I have attended all your academy sessions, but you know, last time when you were having the session, so you told me that I'm generous because I asked another person to take the face-to-face consultation with you.
Okay, was that you?
Yeah, we practice outside.
All right. Okay. Yes. Okay, and I will give you the station. Okay.
Just don't kill me.
No, I'm not gonna kill you. By the way, when you know these games we play in the stations in Plab 2, typical. They play in typical. But we don't go outside the main topic. It's all, as you can see, within the topic. Okay, Dr. Fatima Batul.
Yes.
Okay. "45 years old."
Okay.
45 years old. Ruby.
Okay.
Egyptian as well, we have Ruby. You have Mahira Khan, you have Ashwarya, we have Ruby. We are all, you know. So, Ruby.
Okay.
Presented to the GP clinic with a concern. Now, I've given you 2 messages, the STI message and the MI message. This is a 3rd message, okay? Present with a concern.
Okay.
Yeah, talk to her, this is your concern.
Okay. Okay, Dr. Mo.
Okay, let's start.
Yes.
Okay.
Hello, I'm Dr. Fatma, one of the junior doctors in the GP clinic. Can you please confirm your name and age to me?
My name is Ruby, doctor, and I'm 45 years old.
All right, Ruby. Ruby, I can see from my notes that you have come here to discuss some concerns. Can you please tell me?
Yes, doctor, you know, I have doctor pain on my jaw.
All right.
And doctor, I have pain, you know, around my eye. And you know, I can't eat, doctor. When I eat, just doctor, you know, hurt, doctor, when I eat, chewing, and when I, you know, When I'm getting ready for my partner, you know, I comb my hair, and again, doctor, you know, my scalp is tender, doctor, tender, very tender.
All right, Ruby. May I know that are you having any problem in your vision right now?
Doctor, no, just pain in my eyes, but no problem in vision. I can see, doctor, but just pain, doctor.
All right. And have you ever had this episode before?
No, no. I'm fit and well, apart from some pain on my shoulders, and that's it. No,
All
nothing. I've not had it before. No.
All right, Ruby. What you have told me, I'm suspecting that something serious is going on. It's a threat to your vision. Am I clear so far?
Yes, 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 yes. I can see you. Yes, I can
Yes.
hear
So
you. You are clear.
yes. So for this, we have to give you steroids to protect your vision, and we have to
You give me
refer
what?
you to
Sorry.
the hospital. Steroids.
Okay, okay. You're gonna give me oh, well, I'm not over after this minute. I think they're over.
Okay.
Yes.
So
Okay.
first of all, we will refer you to the hospital, give you steroids, and refer you to the hospital. And for this, I have to call the ambulance because you know we have
Done.
to.
I'm not gonna carry on with the station. Yeah. I just try to put the STI in between for you to forget, so I can do something else, and I signposted. It's another trick, something else to distract you from. Yes, this case is. Guys, remember this. Remember what's going on now, because you will have it in the exam. 100%. You will have an urgent situation either over a video or face to face. Remember this word. Remember this message today. And at this time, ambulance, immediate, hospital. I'm talking, leave the management. The management, we all know the management. How should you do it now? Please. Please, I would not bring you until you please, you know that there is somehow a point needs to be cleared. Phone consultation. Urgent situation. Don't even, elongate it and family and as she. I've given her typical. Ambulance. Then you can carry on, whatever, carry on with the history. Have you had this before? The shoulder pain, this, that, and carry on. But please don't just as simple as no. It is urgent. I'm suspecting something serious. So now we need to contact the ambulance right away. You see how I'm talking? How? If the examiner is sleepy, if he's thinking about what will his girlfriend cook today, what will he have at home, or he will be alert. Slowly, as you tell me that you are having pain in the eye, with the symptoms that you are giving me, to make sure that there is nothing serious here happening. So I will be calling the ambulance for them to come immediately and take you now to the hospital, because you need to go to hospital right now. How long did I spend on talking this? If anybody is not alert, he will be alert. What I'm saying, not like an ambulance in the middle, ambulance, and then carry on. No, guys, are you lost? Okay, because this was quite quick message. Okay, I will do final station and then we'll go. Just one more. Okay, one more. By the way, it's a very important topics. What we're talking about now, very important topics. Okay.
Thank you, Dr.
Yes. All right, Dr. Fatima. Well done.
Thank you.
Yes. You will call, not her. You will call, yes. But you're not gonna call anybody. You're not gonna say wait for a minute, one second. No. You will say we'll call the ambulance immediately, send it, and then you can carry on. Last station. No, with these symptoms, guys, I'm coming now, guys. Please, guys. Pain in my eye now. Now, pain in my eye. Tender, painful. Hospital. I'm not gonna leave here. I'm gonna refer you in 2 weeks with this pain, vision symptom. Any vision symptom? Any? No way. Hospital. Okay. Over the phone. Call ambulance. Okay.
Can you give 2 or 3 more examples of this kind of?
No, that's more than enough. I mean, hey, look. There is how many emergency in the medicine? Dear, hundreds. So I cannot give 2, 3 more. I mean, any station like glaucoma, you understand? A patient is confused, suspecting septic, something, you know. If your sense is saying something serious, because I can count hundreds now. We're not gonna finish. Like, what is urgent really? A patient is short of breath. Now I cannot breathe. Now I cannot, now severe pain, chest pain, severe abdominal pain, severe vomiting, constipation, or obstruction. No, hospital. Okay, my son is having a severe sore throat. He cannot drink, he cannot eat for the past 2 days, he cannot swallow. Hospital. You understand? So, final station. Final station, guys, please. Question, sorry? If a patient is coming, guys, call the case. Come to the GP clinic, he's over the phone. Come, but you will bring him or her. Okay, an urgent, can I tell you a message? An urgent, I grabbed your attention now. Today, you will feel it's an urgent. They will tell you it's an urgent. Only somebody who did not get the message today will not feel it's an urgent. My point is, don't worry. It's not going to be some, no. He will give you, he will tell you, by the way, he will remind you of the lecture. Your head will come here, oh, come. But if you don't have the idea now, you might not have thought about it. But now you know. How do I know it's urgent? If you feel it's urgent, it is urgent. You get me? If you're gonna feel it, it's you're not gonna hide it. It's not gonna say, well, doctor, I think no. Severe doctor, abdominal doctor, severe headache, back in my head, somebody's, Guys, final station. And let's go. Final station. Final. So we had an Egyptian doctor. No. Dr. Mustafa. We had an Egyptian doctor. We had Dr. Batul, Pakistan. We had an Indian, Bangladesh doctor. Who else came out today? I'm trying to make sure that we're covering Myanmar. One Myanmar here. Yalla, nominate one Myanmar. Come out, please. You nominate one victim and come. Yes, doctor, come. I've heard him before. You come. Indian. We did not have any Indian doctor today. Or we did. Did you? Oh, you came out. So okay. How are you? Yesterday I was watching a film, and there was a part of it in Myanmar. In the film, it's an English film, and a part of it was in Myanmar. It's called Target 2. The name of the film is called Target 2, and like half an hour of the film was in Myanmar. Very lovely country. Nature. Yes, because he was running in the whole half an hour in Myanmar. Seriously, the whole film he was escaping, running nature, like waterfalls and. Okay, I'm building a rapport now, so she can relax. Rapport. 14 years old. 14 years old. Any famous actors in Myanmar? But famous good-looking one, not famous old one. Famous recent one. Sorry, Pui. Yeah. Okay, Pui. She's. Am I saying it right?
Yeah.
Pui. Yeah, Pui. She's 14 years old. I'm sorry. She's young baby, and she presented with a concern to the GB clinic. Guys, please, I'm gonna recap the contraception here in this station. Yeah, 14 years old, Pui, presented with a concern. GB clinic. Yes.
My name is Dr. Yua, and I'm one of the junior doctors in this.
Hello, doctor. Hello.
Can you confirm me your name and age?
My name is Pui, and I'm 14 years old.
Okay, Pui. I can say that you have some concerns.
Yes, doctor. Well, I want contraception, doctor.
Okay. What kind of contraception? Like long term or?
Well done. Very important question. She did not make any assumption of emergency. Anybody thought about emergency now? Good job. Okay. So, what do you want? Well, long-term contraception, doctor.
Okay, and before going to that, can I ask you a few more questions?
Yes, please, doctor.
Okay. Are you sexually active?
Well, yes, doctor. I've been using condom, but I just, want to be in the pill long term. Yes.
Okay. And may I ask about your partner?
Yes, you can, doctor. Yes.
Okay. Is he how old is he?
Sorry.
How old is he?
He is 15 years old, doctor.
15 years old. And are you? How did you meet?
Well, we are friends in college, in school.
Okay. And how long have you been together?
Well, we've been together for 2 months now.
Okay. And okay. And do you know what
You know what the pill is for?
okay.
It's capacity. She asked about that. We have 2 factors: partner and. That's it. Do you know what the pill is for? Yeah.
Do you know what contraception
Yes,
is for?
doctor. It's to prevent the pregnancy, doctor. I don't want to be pregnant. I want to have sex, enjoy it without condom, but not be pregnant.
That okay. So okay. Can I know that do you have any medical condition?
No, totally fit and well.
Okay. Are you on any medication?
No.
Okay. Do you have any allergy?
No.
Okay. And I would like to walk you through some lifestyle. Do you smoke?
Well, I don't smoke, no.
Okay. And do you drink alcohol?
Not really.
And I can now talk to you about the types of contraception.
Okay.
Okay. And there are pills and there are devices.
Nah, doctor, no, I don't want devices, please. I don't want. I read about it. This thing that they insert in the womb. I love this signposting. The shot 90%. Sorry, I'm stopping you every time. 90% of doctors. We have COCP, boom, 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 boom. We have POP, boom, 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 boom. We have implant, boom, 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 boom. We have no. We have 2 types. Pills and. Is there anything that you really want me to discuss now? Anything you're interested? Yes, doctor, the pill. So your job is about. That's it. That's what she did. Are you lost? Okay, yes, doctor. I had this device in my womb. No, talk about the pill, doctor.
Right, then I'll talk to you about the pills. And there are 2 types of pills, which the first one is the combined pill,
All right.
which contains the 2 hormones, estrogen and progesterone.
Okay.
And the second one contains only 1 hormone, which
All
is
right.
called
Okay.
estrogen. Okay. And I'll talk to you first about the first one. Okay.
Yes. Okay.
Okay. And do you?
Well, I don't want really this one with estrogen because I heard that has some complications and blood clots and no, I'm really interested in the mini pill.
Okay.
The progesterone only pill, the mini pill, called the mini pill, yeah? Progesterone pill, the mini pill, doctor.
Okay, what do you already know about the pill?
Well, I know nothing really, but I know that, it's a pill that I should take it every day at the same time.
Yeah, that's correct.
That's all.
Okay, but the thing is that you need to take the pill at the same time every day.
Yes.
Okay, please make sure
Yes.
that you take it at the same time.
Yes.
Okay, and but do you know any side effects of the pill?
Not really.
Oh well.
I heard from my friend. She told me that my boobs will be a bit tender.
Yeah, that's correct.
Yeah, and she told me also that I might be a bit crazy. I might argue with my boyfriend a lot when I start using it.
You
But
can
yeah.
have some mood swings.
Yes.
And also you will have some period irregularity.
Yes.
Okay. And do you have any other concerns?
Well, doctor, I mean, now I am on my second day of my period.
Okay.
I mean, can I start this from today?
Oh, sure. The pill can be started from the 1st to the 5th day
Of my period. Okay.
Yeah.
So if I started today, doctor, I mean, do I need to use condom after my period stops for some time, or I can be protected right away?
If you start after 5 days of the period, you can.
No, senior. He's talking now, yeah?
Yeah. You do not need to use any condoms.
All right. Okay. All right. Doctor, is there any contraindication for this pill?
Well, the progesterone is quite safe and is unlike estrogen, and it doesn't have any contraindication.
All right, okay. You know, I'm really, as you know, I'm 14 years old and I get distracted with a lot of things the whole day and things. And my day is busy, really. What if I miss one pill, doctor?
Okay. There are two types of progesterone pills.
You see? Two types now. Now she remembered. Because there's two types, the 3 hours and the 2 hours. Yes, doctor.
The first one is the window of window of 3 hours, and the second one has the window of 12 hours. Okay, so if you miss, you are taking the 3-hour window pill,
right,
and
yes.
You miss to take the pill within 3 hours.
Perfect.
You have to use the condoms for 1 week. But if you can take,
if I miss it more than
more
3
than
hours,
3
okay.
hours,
What if I miss it less than 3 hours?
and it's not any problem, and you can just take as usual.
All right, okay, all right. Doctor, like, do I have to take it every day, or is there 1 week rest of this pill, or is it daily one? For how many days will I take it? 28 days or 21 days or 21 days?
The progesterone pills will need to be taken every day for the full 28 days.
Right.
The COCP, the one I mentioned, the combined pills, it has to be taken for 21 days, and the 7 days the rest days.
All right, okay, okay. All right, doctor.
Do you have any other question?
Well, no, doctor. You really answered all my questions, doctor. So, sometimes when I take some antibiotics and some medication, sometimes my tummy doesn't hold it. Sometimes I vomit. So if I start taking this pill and I vomit, is everything all right? Should I just take another one? Should I not take another one?
That's a very good question.
You see, that's a very good question. He's reflecting on what I'm saying. Yes.
If you vomit or if you have loose motion within 3 hours after taking the pill, you have to take another one.
All right. Okay. Okay. Okay.
And if you are taking some antibiotics like rifampicin, have you ever heard of that?
No, no.
Okay, and if you're taking
now, that's not needed now. Now she wants to talk now. She's got a lot of knowledge. If but there is something called rifampicin. No, really. Now I'm gonna be lost. I'm 14 years old. I want what because the more you talk, the more the 14 she's not gonna be really focused. So no need there. You get me? Unless I ask you, doctor, is there any antibiotics? Then you can say. But I only spoke about vomiting. Answer, okay? Viva Myanmar. Well done. Well done. Good communication skills. I'm sure you all know. You all noticed the communication, and I don't know. Did you what we mentioned today? Anything was new in the contraception, or did you? Or was all because she seemed on the spot. She seemed the lecture is there on her head. She was not really. Did you notice the lecture was there? Like what we've done, it's in her head. That's what. No, really. Did you read what we said before in terms of what the new concern, or no? Because she had when I said to her, doctor, what if I missed? She said, okay, there's 2 pills, 3 hours, 12 hours. It was really. But do you know now the importance of knowing the concerns? What about this? I'll go back to my senior. What about that? There is another senior who's available. I'll talk to him. What about that? There is one more senior. We have many seniors here. Well done. Well done. Well done. Well done. Well done. Guys, thank you very much. Please, contraception, read them again. Concerns, emergency situations in A&E, Allwood Hospital, STI, sexual history, unprotected sex. I'm going to end the meeting. Thank you, online doctor. Thank you very much.
Dr. Mo, may I ask you something?
Very, very,
Dr.
very
Mo?
much, guys. I really
hello, Dr. Mo?
good session. Yes.
Dr. Mo, may I have a word with you, please?
Hello.
Hello, Dr. Mo. Hello, yes, Dr. Mo.
Yes,
may I have a word with you, please?
Yes, yes.
Pardon my off-topic asking you, but it's really important for me to know. When are you coming to Dhaka in July?
Sorry?
When are you coming to Bangladesh, Dhaka in July?
1 second. Hello. Hello? Can you hear
Yes.
me?
Hello. Yes, I can hear
Can
you,
you hear
doctor.
me?
Uh,